with her, we also have Mr. Marco Villanueva, who is one of her students. So we're going to be talking a little bit about the STC program. We're going to be talking about a day in the life of one of the students and really getting to know if this is something that our students are interested in. So without further ado, I'd like to welcome Ms. Crystal Bird and Marco.
Thank you. Good morning, everyone. Thank you for inviting us to speak to you today. My name is Crystal Bird, and I'm the chair of the Diagnostic Imaging Department at South Texas College. I'm very excited to be here today to have the opportunity to discuss the programs that are offered within our department. With me, I also have one of my second-year students, Marco Villanueva. Marco is a student in our Radiologic Technology program, and he's also the president of his class. So he is going to be sharing his perspectives of what it's like to be a student in one of our programs and to answer any questions that you may have. I'd like to begin our session with a presentation. We're going to spend about 20 minutes discussing the specifics about the department, learning about the programs, and then we're going to continue our discussion with Marco. So I would like to put up a PowerPoint presentation that I have prepared for you. And let me put that up, and please let me know when you can see it. Can you all hear me?
I can hear you, and if you go ahead and do your share screen, you should be able to bring up the presentation.
I brought it up and I lost you. I can't see you.
That means it's...
But that's okay. As long as you can see me, then we're all right. Okay, everyone. We are going to begin with discussing our department and discussing what diagnostic imaging is. So the term diagnostic imaging encompasses various types of medical imaging that provide visual representations of the human body. Our department currently offers programs in 3 different modalities. The first program that we're going to discuss is the Radiologic Technology program. Radiologic technology uses an X-ray tube that produces radiation, which is used to create a diagnostic image. This program offers an associate degree in applied science.
And Ms. Bird, are you sharing your PowerPoint?
Yes, I am. Can you see it?
We can't see it, so
Okay.
maybe we can try to share it again. Let me put Claudia.
Okay, hang on a second. Let's see.
There you go.
Okay, we're there. No, we need
Yes,
to...
you're there, and you just need to do the presentation mode.
Right. Okay. Are we on board now?
Yep.
Yes.
Okay, now I can see you too. All right, everyone, I'm going to back up a little bit so you can actually see the images that I have associated with the PowerPoint. As I was saying, the term diagnostic imaging is going to encompass many types of medical imaging in seeing the anatomy of the human body from different perspectives. So our department currently offers 3 different programs. So we're going to start with our Radiologic Technology program. And this technology uses an X-ray tube, which is right here where I've got my cursor pointing over. And the X-ray tube produces radiation, which is then used to create a diagnostic image. And students who complete this program will earn an Associate of Applied Science degree. Our second program is the Diagnostic Medical Sonography program, which is an advanced technical certificate, or is referred to as an ATC. Sonography varies from radiology in that applicants for this program are required to have a minimum of an associate degree in a nursing or allied health profession. Sonography differs from radiology in that it uses sound waves instead of radiation in producing an image. So what you're seeing on this, are you there?
Yes.
Okay, sorry. A common procedure that you're seeing here is an image of a fetus in the mother's womb. So this is a very, very common procedure that we do for patients on a regular basis.
And Miss Bird, let me ask you something. Is it harder or more difficult to get a sonography certification than it is a radiology? Is there a big difference?
Yes, actually there is, because there are different modalities within the diagnostic imaging field, and radiography is going to serve more as the foundation, as the starting point to get an associate's degree. And then from that point, once the students have obtained that, then they could possibly apply to the sonography program.
So
And
somebody out of high school wouldn't be able to just go into a sonography program.
not in STC. Basically, if there's institutions that offer an associate in applied science in sonography, then they would be able to.
I see.
So the starting point for students, especially in high school, will be the radiology program, and that's going to be the focus of our discussion, because this is going to be where they're going to start.
Okay.
So
Do you want to come to?
the third program that we have is going to be the computed tomography, or the CT program. And this is a certificate that is going to be offered only to licensed radiologic technologists. So this is going to be an expansion of their skills. And this modality uses radiation also. However, it's a bit different, because instead of using a stationary tube, the X-ray tube is going to travel around the patient in a circle, and it's going to create many slices of the patient's anatomy instead of just one image. So if you look at the images that I have on the screen and you look at figure A, this is the chest X-ray of the patient's lungs that is going to be produced in the radiologic technology program. And if you look at image B, this is going to be of the patient's lungs using CT. And image A, there's a definite mass in the patient's lung here, but we can't really see it exactly. It's a little bit obscured, and we need to follow up with this study with a CT procedure. So if you look at figure B, now you can see the same mass, and you can see it in its entirety, and you can see exactly where it is. So very often when patients come in for procedures, they will have more than one study done by one of the different modalities that are going to be offered within the diagnostic imaging department. And that's what we do at STC. We're offering more and more programs so that we can train individuals to meet the medical needs of the patients within our community. All right, so that being said, although we offer 3 different programs, I'm going to focus on the one that's going to apply more to high school students and individuals that are wanting to come into the diagnostic imaging field. So that program is going to be our radiologic technology program. So we're going to begin with talking about this program by defining what radiology is. And radiology is the medical profession that uses radiation in producing images in the diagnosis of various injuries, illnesses, or disease processes. So let's take a look at the X-ray that I have on the right side of the slide. Basically, we've got a big thumbs up here for radiology, because we love radiology over here. And our job is to look at this X-ray, try to take the best image that we can, and see if there's any abnormalities. So we have to look at the entire image, but I want you to focus in, especially on the thumb that we have here on our thumbs up. And what we're looking for here is we want to see 3 bones that are intact. So we want each bone to still be in one piece. If it's not, then that's going to indicate that the patient may have a fracture. So by telling you all that, we've got this bone, then we've got the one on top of it, and then we've got the very, very last one. So I don't know if you can tell if you think this looks normal, or maybe there's any broken bones in there. So to let you know, to help you out, we do have some broken bones, and this patient does have a fracture, and it's right here is indicating where the blue arrow is. And basically there's a fracture here and here. And it's the radiation that we use from the X-ray tube that allows us to see inside of the patient's anatomy so that we can treat any injuries or any conditions that they may have. So in the radiology program, you would train to become a licensed radiologic technologist, who is also known as an X-ray technologist or a radiographer. And our job is to take the highest quality x-rays that we possibly can, and we submit them to the radiologist. And the radiologist is the physician who's going to interpret the images and diagnose the patient. There's a difference between a radiographer and a radiologist. So the radiographer takes the images, and the physician, the radiologist, which takes an additional 12 years of training and a medical degree, they're the ones that are actually going to be diagnosing the patient. So we have a lot of responsibility in trying to get the radiologist the best images that we possibly can. So in the program, the students are going to be trained in performing different types of exams to include radiographic procedures, fluoroscopic procedures, and surgery. So I'm going to briefly discuss the difference between each one of these to give you all an idea. So the first one we have is going to be radiography. So this uses the x-ray tube, which we have here positioned over the patient, and it's going to act as a camera in taking an image of the patient's anatomy. So the image on the right that we have this time is going to be of the patient's elbow, which I think this one might be a little more obvious to you, that we do have an abnormal finding here. And basically the finding that we have is going to be in the patient's elbow, which we've got a large fracture, which is indicated here by the blue arrow that I'm showing you. The next one that the students are going to learn is fluoroscopy. Now, fluoroscopy differs from radiology in that the radiographs are going to produce an image in the way that a camera takes a photograph. So that's going to be a still image. Fluoroscopy, on the other hand, is comparable to taking a video of something in real time. So fluoroscopy is still using the same x-ray tube, but the image is going to be dynamic. So in this image, the patient's esophagus is being evaluated. So the patient's going to drink something that x-rays have a hard time going through, which we call contrast, and the contrast is outlined in black. And you all are seeing the contrast go through the patient's esophagus every time that they swallow. So normal versus abnormal swallowing of the contrast is evaluated by the radiologist to determine if there is an abnormality. So in this case, there's not. So this is, the name of this procedure is called a modified barium swallow, and this is normal findings. So this is something that we would like to see.
And I have a quick question.
Sure.
On that barium swallow that you talk about, is it a specific liquid that they're drinking in order for it to be able to make that contrast?
Yes, it is. There's different contrasts that we use, but for anything that we want to outline the gastrointestinal tract, we're going to use barium. So barium looks like a thick white milkshake, but it doesn't taste quite as good as a milkshake.
Yeah, that's what I was hearing. But you know, my question is, have they made it any better tasting?
Yes, they have. They put flavors, but you can still taste the barium, but it is better. So it comes in banana flavor or basically anything that you would want. So adults, usually it's not too much of a problem asking them to drink it, but if you ask a 2-year-old or a 3-year-old, they probably still aren't going to want to cooperate as much because it doesn't taste quite as good as something that they would like to drink. But the barium has, it's very thick, and because of its composition, x-rays have a hard time going through it. So where we normally would not be able to see the esophagus, we can very clearly because the patient's drinking barium. And we can outline the esophagus, the stomach, small intestine, large intestine. It can go all the way through the patient depending on the area of interest.
Wow.
And the last type of procedure that the students learn are surgical procedures. So this utilizes a combination of radiographic and fluoroscopic images to aid the surgeon in the operating room. So the equipment used for this type of procedure is called a C-arm, and it is named for how it looks. Basically, if you look at this area, there's an x-ray tube here, and on top we see an image intensifier, and the two are connected by an apparatus that looks like the letter C. So that was the best name for it. And this is a mobile piece of equipment that's capable of moving from one operating room to the next with ease. And here we've got another x-ray to show you. This is of a patient's femur that is clearly broken into 3 distinct pieces. This is a very, very severe fracture. So what we did was we went into the operating room, or the OR, we took our C-arm in there, and we helped the surgeon in looking inside of the patient's body and seeing exactly where the fractures are so that they could repair it with a rod that we have here and lots of screws that are basically going to keep the patient's femur in one piece. And this image is actually taken 16 months after the procedure was performed. And if you notice, there's still a little bit of abnormalities in the way that the bone healed, but the patient is able to walk and continue their, normal activities because of the help of the C-arm in the surgical suite. So we have a very, very important role in performing lots of different procedures within the diagnostic imaging department.
I have another question.
Yes, ma'am.
I actually, when I was 15 years old, broke my ankle and had 12 screws put in. But after, I want to say it was 2 years that they removed them. Is that something that's typically done during these types of surgeries, or are these permanent fixtures?
It depends on the procedure. It depends on the fracture.
I see.
Because there are some times that the internal, the prosthesis, screws, things like that are put into the part, they need to stay in order to keep the bone intact. And other times they are able to remove it. Okay. So that's good that you got to have yours removed.
And do these go through, like when you go through the airport and when you go through those machines, do they beep?
They're going to show up because they do have metallic properties in them. So, but for the airport, they use very, very low radiation. So it's not anything to worry about. It's not going to, and they can actually tell whenever they actually scan to see exactly where the metal is. And they have different types of metals now that they use.
Oh, wow.
For prosthetic devices.
Perfect.
All right, everyone. So now that we know a little bit about the field of radiology, we're going to talk about the application requirements. So entrance into the radiology program is going to involve a few steps. There's prerequisites that need to be completed. There's selective admissions requirements, which means there's additional criteria that needs to be met. There's an application deadline, which is always the last Friday in May of every year. And students are selected based on a point score system where they're ranked from highest to lowest scores. And that's an image of 2 of my previous graduates in our classroom. So just to kind of show you a little bit about our website, I've taken a screenshot of the application requirements, which is letters A through L, to let you know what all needs to be done. And you can find this on our website, which I have on one of the last slides that I'm going to share with you. And I'm going to kind of briefly go over a few of the criteria that needs to be met. So the first thing we have is our required prerequisites. So we've got our introduction to radiography and patient care, which has to be current within 2 years from the application date. We've also got Anatomy and Physiology 1 and a math elective, which has to be current within 5 years of the application date. And then there's English Composition 1. So prerequisites mean that you have to complete these prior to applying to the program. There's also exam scores. There's a TSI, which students can either be exempt or they have to complete. And then there's the ACT exam, and anybody who applies to our program is going to have to complete this. So in the areas of English, math, reading, and science, there has to be a minimum of a 16 in each of these individual areas, and there has to be a composite score of a 19. The writing segment is also required for us. So that has to be a 6 or above, and the ACT scores have to be current within the last 5 years from application. There's optional courses that you can also take that will give you more points, and these are called co-requisites. So these are 3 courses that are within the degree plan that have to be taken before you graduate, but you don't have to take them prior to applying. So if you have the time to take any of these 3, then that means that it gives you more points, which increases your chances of getting in. So there's Anatomy and Physiology 2, our Social and Behavioral Sciences elective, and then there's a Humanities elective as well. Anywhere where you see elective, you can pick from any one of the electives that are within the STC system, and they would be acceptable for our associate's degree. There's also two courses that I have outlined here for you that are highlighted that are not in the degree plan, but they do apply to the program in that they help students be more successful. So the first one is the College Success for Healthcare, and the second one is the Medical Terminology one. And I've also given you kind of a preview of the point system where you can see the legend that we use. Notice the points that you get for A's, the points you get for B's. Notice in the prerequisite courses, there's no credit for C's and D's because you have to have a B or better in the prerequisite courses. In the co-requisites, we give you credit for any grade that you get, but you get more points for the higher that you score. Your ACT, you have to get a minimum of a 21 or better, but if you score higher, then more points. And also you get that extra credit for A's and B's for those optional courses that we have. And here's
I have a quick question. In addition to the point system, does the program also do interviews or are any other factors taken into consideration besides the point system? If somebody's interested in that program, is there anything that they can do to prepare themselves and make themselves a more suitable candidate?
Every program, that's a really good question, because within the Nursing and Allied Health Division, every program has their own selective admissions criteria. Some do interviews, some there's volunteer work that you can do. In radiology, there is no volunteer work because students are going to be exposed to radiation. It's very low levels and it's very safe. But due to that fact, they can't do volunteer work prior to be accepted into the program. And we don't interview as well. So our program is strictly based on GPA. Okay. The number of courses taken toward the degree plan and the grades that the students get. And the GPA that goes toward STC, any programs taken within the college, and those specific to our degree plan. So it's a really good idea to attend advising sessions. Don't follow the degree plan on your own. So that way you know these things and you know how to increase the opportunity for you to be selected for our program.
Okay, thank you.
Thank you for the question. And our degree plan might be kind of hard to see. It's a little bit small, but it starts from our prerequisite semester, which has our 4 prerequisites that we've already discussed. And students begin in the fall of every year, and it's a full 2-year program. So the first semester and most of the semesters, they're going to take 3 programs within the radiology program. And then we've got the co-requisites in there kind of at random within different semesters. But if students haven't taken those courses, then they can take them whenever they so choose throughout the program. So it starts first semester, second semester in the spring, and then in the summer. And then they do that again for another year. And the courses are going to involve anything from didactic courses in the classroom. They go to clinic where they actually work with other licensed radiographers and work with patients. And they basically are able to perform competencies that are going to allow them to start working immediately upon graduation from the program. And our program is going to be 6 semesters in length once the students actually enter the program. So as a summary of our program, it's 2 years, 6 semesters, as I mentioned. You get an associate degree in applied science, and you're also eligible to sit for the American Registry of Radiologic Technologists, or the ARRT National Registry, to become certified and get these credentials behind your name, which the RT is for Registered Technologist and the R is for Radiography. And the more certifications you get behind your name with different modalities like our sonography and our CT, well, then the more money that you're going to earn. So there's a lot of opportunity for advancement in our field. The tuition and fees for our program is about $11,000, and it includes all the courses in our degree plan. By the time you add your program uniforms, you add supplies, books, and additional items that you need, the total cost is going to be a little over $15,000. So this is something that I think that our tuition and fees are very reasonable at South Texas College, and also in comparison to some other educational institutions that are around our area. So we're proud of that, and we try to make it affordable so that we can accept as many students as possible and fill the need for radiologic technologists in our area.
Perfect. I know that we are getting close to having DHR come on board to do their simulation presentation on their office. So I know that you had Marcos here, and that you also had a couple of wrap-up comments and questions for the students. So I don't know if you want to get started with that.
Yes, absolutely. I just want to mention one more thing, that we have 100% examination pass rate.
Wow.
Which is basically, we've had it for many, many years. We've been in existence for 20 years. We're very proud of that. We have 100% pass rate for every single one of our programs within the department. So there's an excellent job placement for this field, and I do want to really quickly go over the salary range, because that's
sure.
So the salary range for our full-time graduates is $18 to $19 per hour, which is a 40-hour work week, and that includes benefits. And then as far as the PRN, which means as needed, this will be part-time or as many hours as the medical facility needs you, and the hourly wage goes up to $30 per hour. And there's a lot of room for career advancement through additional education like bachelor's degrees, master's degrees, and those certifications and those special modalities that we had discussed. So I am going to minimize my screen, and we're going to go back to the full screen here so that we can have you all ask Marco some questions. This one. And we are getting there. Please excuse me. There we go. Can you see us?
Yes.
Okay, great. Okay, Marco, would you like to tell us a little bit about yourself?
Yeah. My name is Marco Villanueva. Like Ms. Burt was mentioning, I am the president for the class. Basically, I joined radiology because it's something that interested me since I was little. I actually got some x-rays taken when I was younger because I broke it's funny, right? But I broke a toe. And as soon as I saw that, I thought it was incredible. Since I was little, I was into superheroes, and it sounds kind of cheesy, but it makes me feel like we have a little bit of x-ray vision. And it's fun. I mean, the program that SCC offers, it's a great program. The instructors are great. They teach us to the point where we feel comfortable in class, but also in clinic, and we know what we're doing. We know what's right and what's wrong, what we should do to position the patient, and what we shouldn't do to position the patient in some certain scenarios. So yeah, that's my main reason to be in the program, was because of the interest in radiology that I had since I was a young boy.
And Marcos, do you find that the program has been difficult for you? Has it been challenging? Are you full-time? Do you have a job? What is your current situation?
I actually work right now. I am working as a transporter for a radiology department in DHR. The program is a little bit challenging, but I mean, like I always talk to we're two classes, the seniors and the freshmen. So I'm currently one of the seniors. Like I always tell the freshmen, the class that's after me, it all comes down to how much you want to be something. If you really want something in life, you're gonna give it 100%, and that's what I'm actually giving it right now. It's 100% to my school, 100% to my job, and it's workable. It is a little bit challenging sometimes when it comes down to studying, because I usually study like at least, I want to say, an hour to 2 hours for each classroom hour. So it's a little bit challenging, but I mean it's great to know what you're doing and to know what you're seeing in clinic. So that's the fun part about it, reading the book and actually getting to see it in clinic, and that's the best thing about this program.
Marcos, thank you so much. And thank you so much, Miss Bird. What I'm going to be doing right now is I'm going to put you on mute and I'm going to go ahead and go to our clinical partners. But if I could ask you to please stay on. And in the end, if we have any other questions, we'll get you guys to answer some of the questions that the students have. So with that being said, I am going to, there you go. Let's see. Jessica, can you hear me?
Yes, loud and
Okay.
clear.
Perfect. If
Well,
you'd
good
like
morning.
to kick off your session, thank you so much for being here.
Yes, our pleasure. So hello, everyone. Again, thank you for inviting us, Dr. Alvarado. I'm Jessica Salinas. I'm here representing Doctors Hospital at Renaissance, and we are very proud to be part of this program. This morning, we are going to feature our radiology team because they are the ones that get everything done here at Doctors Hospital with this concept that STC has just talked about. So I want to turn the camera around and put our team on. Give me 1 second. Say good morning, guys.
Good morning.
Yay.
Good morning.
At Renaissance, everyone. This is one of our digital rooms that we're at. My name is Maribel Tharp. I am the radiology manager here at Doctors Hospital at Renaissance. And with me, I have Angela Williams. Good morning. She is our X-ray and fluoroscopy coordinator, and both of us are STC graduates, as we just went through a presentation with South Texas College.
Woo!
Yeah. So right now I'm going to go ahead and turn it over to Angela. She's going to talk to you a little bit about the radiology the work, the job responsibilities as a radiologic technologist. And then I will come in and discuss a little bit more about where you can build from that foundation. We also will have one of our ultrasound techs that can talk a little bit about the ultrasound field itself. So I'll go ahead and pass it over to Angela.
Hi everyone, I'm going to be showing you the digital room and our equipment as well as a portable machine today. I've been doing x-ray here for about 11 years. I'm going to have my helper, Albert. He's also an STC graduate. He's going to be helping me show you how to use this machine today. So basically when a patient comes in, if for example, we're going to be doing a chest x-ray. We do chest x-rays for all kinds of reasons. The patient will come in, they'll change, we'll have them stand up against this bucky right here, get positioned so that we can visualize all the anatomy that is required. Can you see that? I don't know if you can
Yes, we're good.
Okay.
Yes.
So
Perfect.
basically, this is where the X-ray tube is. This is the collimator. So this allows me to move my light field to include the anatomy that I need to include. There we go. So basically, we would just position, which is what you learn basically in your first semester as a student, how to position for a chest X-ray. Albert's a very good subject. He knows already what to do.
Good patient.
So we would position here, and then the tech would go, if you want to follow me this way. As a tech, you would go back here to your control area. Behind this lead shield. The glass is lead so that you are protected from any radiation. You would tell the patient their instructions, breathing instructions, and then you expose your x-ray. I don't know if you can get that.
Very good.
The computer there.
Thank you so much.
Got it?
It's got it.
Okay. All right. So this machine is very interesting. We have what's called a smart button. You want to go ahead and lay down, Howard? And it's interesting because a lot of machines are not completely automatic.
This one?
This one, I just have to press a button, and the machine will move for me.
Yeah,
Oh,
see that?
wow.
And I can go from standing to laying down.
Wow, look at that.
That's super fancy.
This one's moving too.
Yes, here we have top of the line equipment. It's all
Wow.
digital.
Wow.
There we go. They're all moving.
So any of the exams that we need to do lying down, whether it's extremity work or say an abdomen or a spine, we can do it very easily and very quickly with this equipment. Such a good patient. Okay. to show you a little bit about our portable machines. These are also completely digital. And these we take up to the floors, to patient rooms. We take it to the pre-op area, to recovery area, all over the hospital. Basically, you can do x-rays anywhere you need to. So what we would do is, instead of having this bulky bucky that we have down here, we have just the image receptor, or the cassette, right here. And this you can take anywhere you need to. Patient would just place the anatomy on the cassette. And you would just position as you normally would. We do carry markers. These are required on every single exam that we do. And basically, I don't know if you can see, well, it has tape on it, but it does have an L and then it has initials on it so that every tech is distinguished. Every x-ray that we do has our initials on it and what side of the anatomy we are looking at. And that helps the radiologists. Can you get it?
Got it.
Okay.
Very cool.
Okay. And I have a quick question.
Sure.
With these portable devices, in comparison to the device that you just showed us now, is there a difference in quality between like a portable device and a big device? Like, do people get better x-rays on the bigger device than they do on the smaller device?
Not necessarily. That's where your knowledge of technical factors, the use of the grid and everything like that. I mean, unless it's an extremely large patient, we really don't see, we don't see too much of a difference. It's mostly whenever you have a lot of excess tissue, like in the abdomen area, in the hip area, that, you know, if you're focusing on the pelvis or something like that, if it's a large patient, you might have a little bit, but not too much loss of quality.
Oh, okay.
Any other questions?
Any other questions on that end?
No, I'm going to be opening it up to the school districts and the coordinators. So if any of the students have any questions that they'd like to post, I'll go ahead and let you know as they come.
Okay.
How many technicians do you guys have at the hospital? Like, how many people are out there taking x-rays on a daily basis at the hospital?
So I'll step in with that one. We currently have 330 employees in our radiology department. Now, we do have our main radiology department here at DHR. We have a smaller department over across the street at our women's hospital, and we have 8 imaging centers plus some other ancillary imaging facilities. Cool. So across the board during the daytime, I can say we have about 12 technologists, 12 to 15 technologists working during the day. We also have 6 rad techs that are in the OR running C-arms, which is basically like a portable unit, but in the shape of a C and a lot bigger, you know, so that way they can use imaging during back surgeries, extremity surgeries, removing gallbladders, that kind of, you know, those efforts on the surgical side. So we do have a lot of technologists. We also have 4 to 6, depending, in the evening, including our surgery techs. And that's just the diagnostic imaging side. We have CT, MRI, and all other modalities working.
Okay, we just had a question in from MedHigh. One of the students wants to know what happens if you have a problem with the machine while you're taking an image and you're with a patient?
Okay, so a lot of the times, you know, when we do have issues with our machines, as a technologist, you are trained on the equipment when you're hired on. So you're trained what you should do. Let's restart the machine. Let's reboot it first. What type of issues are you having? Is it that it's not turning on? It's not exposing? So you'll always start, you know, by restarting the machine first. Then if that doesn't fix the problem, We do have a coordinator during the daytime that you can go to with more experience on these machines, as well as an evening shift supervisor. Now, we do have multiple machines. So if one machine is giving you trouble, then we kind of put it down for the night and call in service on it. But we have 4 portable units that we use right now. So you can always call someone else, hey, bring me another portable, I'm having trouble with this one, and they'll take one up to you and bring the other one back down.
Another one.
Solution.
Okay, another one of the questions that came in is, what would you do if the patient wasn't able to move for the x-ray?
Okay, so we do come across patients, particularly ER with traumas or in ICU, where they're unable to move or their range of motion is limited. So as a technologist and as a healthcare professional across the board, you are trained in certain methods of lifting and rolling patients so that it reduces injury on your body. On a, I guess, general scale, we are basically required to be able to lift 50 pounds. So if you have a patient that weighs, let's say 150 or 200 pounds even, then it would require 50 times 4 is 200. So 4 individuals to assist in lifting. Now that doesn't mean that you have to have 4. If you're just trying to lift the chest, then there isn't 200 pounds on the chest. So if you get yourself and the patient's nurse to assist in lifting, or if you have your evening supervisor that can go up and help you, we always help each other out. Our purpose is to limit any time and reduce any type of injury to ourselves. So there is definitely training in body mechanics and also your team members to assist.
And what if the x-ray comes out blurry? Like you're taking it, and it comes out blurry. Is that something that you are still able to use, or is that something that would have to be retaken?
It would have to be retaken, because anytime you see blurry, there's usually motion, which means either the patient was breathing when you told them to hold their breath, or they coughed, or they moved. So a blurry image isn't a diagnostic image. So we do have to repeat that. But that's also part of your training. As a rad tech, you'll learn what is good quality and what's diagnostic quality, as well as your training period at your job site.
Okay, we got a couple more. Can too many x-rays affect a patient? And what happens if a woman is pregnant and doesn't know and she gets an x-ray taken?
Okay, so as far as x-rays themselves, like Crystal mentioned earlier, it is very minimal radiation. If you're getting one chest x-ray, or an AP and a lateral x-ray, versus if you're an inpatient and having CTs and x-rays throughout the day, every day. So it's not extremely hazardous, but should it be repetitive or an accumulation, then yes, it could have effects. And that is also part of the training as a rad tech student. As far as a pregnant patient, we do conduct a screening prior to performing any type of x-rays. So, the x-ray, the screening section talks about the last menstrual period, if they have even started their menstrual, if a female has had any type of surgical procedures to prevent pregnancy, such as a tubal ligation or a total hysterectomy. For our wiser females, to see if they've already undergone menopause for at least 12 months. So there's a screening section that we do conduct on all women prior to performing any type of x-rays. And that helps us to identify women that, whether there is a possibility of pregnancy or not. There are pregnancy tests that we offer and sometimes require if it's a certain procedure that maybe involves the pelvis area, where the radiation would be directly on, the embryo if pregnant. So we do conduct our preventative screening.
Okay, and I guess a question more for DHR as an employer. What do you look for in candidates that want to work there at the hospital, either as rad techs or sonographers, or what is it that would make a candidate ideal for your particular organization? And before you do the interviews, is there something that stands out to you when you're reviewing their application that may help them have an edge in get the employment? I know that a lot of our students are very interested, and a lot of them are very competitive and want to know what can they do to make their application stand out? How can they be the better candidate?
Absolutely. So one of my responsibilities is hiring for our department, particularly the rad techs, the radiologic technologists. And what I look for on an application is, one, that they graduated from an accredited school. So since we are partnering with South Texas College in our continuing our higher education efforts here, they are an accredited school. I just wanted to go ahead and make that clear. And the second thing that I look for is, their clinical rotations. I kind of get an idea. So if you list some of those on your resume, that is really good. So that way I can kind of already get an idea of the type of exposures that you've had. And any prior work history, in customer service, in any type of employment that you're actually dealing with a customer, any interactions, because a lot of your job here, aside from taking the x-ray, is patient care. And we take great pride in our customer service and our patient care here at Doctors Hospital Renaissance. So that is of the utmost importance. During an interview, what I look at is communication and your body language and your personality as a whole, your attitude about things. So that is actually what I'm visualizing during an interview. We can go through the process. I don't know how great of a tech or how great of a student you were unless you rotated through my site. However, I can see how great of a personality you have, or how, and so I put myself in the patient's shoes. If I was here and you were taking my x-ray, I would feel very comfortable. I would love having you be my x-ray tech. As far as training, I can train you how to take a chest x-ray or how to position better, but we can't train you to have a great attitude and provide, excellent service to our patients.
Well, I'm glad that you're saying that, because that's something that we often talk to the students about, whether it's in radiology, sonography, or in nursing, is that it's important to be able to have great communication with the patients and really develop a good bedside manner and have a great attitude. And I'm glad that the students are hearing it from you, particularly because you're the hiring manager there, that in addition to being able to do your skills as a technician, you also have to have other skills. And these other skills are important to businesses such as hospitals because they want to ensure that the patient has a great experience. So thank you so much, Maribel. That was very insightful. And I know that we're going to be going through some of the other questions. So school districts, if you have any other questions, please go ahead and use your chat feature and post them up. And Maribel, I don't know if you have any questions for the students or any questions about our program, but we'd be happy to answer as well.
Well, I don't necessarily have questions because I know you guys are doing a great job, especially just seeing the type of stuff that you're doing for high school students here in the Valley and across the board. But I do want to also just mention that this is a foundational, area. Some of my technologists are happy where they're at, and they don't want to go into other modalities or anywhere else. They love their jobs, and that's okay. But there are other modalities that as a rad tech, you can continue your training. Crystal Bird from South Texas College mentioned about CT. They have a CT certification program, which I myself went through. Just so that I can have a better idea as a radiology manager what exactly CT entails, and when they're talking about this, I can understand the jargon. But it is a very good training certification that you can build on, and with that there's also additional compensation. It's a different type of modality. There's also MRI, so that's another area that you can train into. MRI particularly looks at musculoskeletal a little more thoroughly, like the joints. You'll hear a lot of MRI when you're talking about sports injuries and, back pain, as well as, brain activity and such like that. We also have interventional radiology, which I like to call a mini OR, because you do some of the stuff that you could do in OR, but it doesn't require, to be put under sedation, or just, it's on a smaller scale. That's how I call it. But they do a lot of, intravenous stuff, a lot of declotting for, trying to think, the outpatient vision, for outpatient, yeah.
With the ports?
Yeah, with the ports and
Yeah.
stuff. Yeah, different
Port
port
insertion,
insertion, central line, yeah, exactly. So they do a lot of line placements, and we also have ultrasound. So ultrasound, everybody typically refers it to where pregnant women see their babies, but it goes way beyond that. We look at muscular, we look at the arteries and veins. We look at all types of organs in the abdomen. We do breast imaging for detection. There's just so much more to ultrasound. And you can, at STC, if you graduate from the RAD-Tech program, continue your education into ultrasound if it's something that you're interested in. There is also mammography. Some of, the techs love mammography, and that's something that they can go into. So all of these are different areas that you can continue growing your career from a rad tech into a CT tech, MRI, interventional, or mammography. There's so many areas that you can build from. So that's one thing that I really liked about the rad tech program itself, is that it's something that you can build on if you choose to. Aside from that, I myself, like I mentioned, was an STC graduate. I started working here at Doctors Hospital as a C-arm tech in surgery, and then I came into fluoroscopy, and from there started building on, assisting with little tasks and such with our management team, and then filled my role that I am now as a manager. So, there's definitely promotion and definitely advancement in this area.
Perfect. And for example, for all of those different certifications, do you think it's feasible for someone to be employed and also work on the certifications? Or is this something that you think that if you're employed, you probably will have to leave your employment and then go work on the certification and then come back? Because I know that one of the things that we're often told is that a lot of the students like to be able to have flexibility on the courses that they're taking so they can still work a little bit and take courses. Do you think that that's something that in your experience has been possible?
Well, as far as the CT certification, I took it while I was a full-time radiology manager. So that was an evening course that they set up that time around. I'm not sure how they've established it since then. However, I have had plenty of techs that have either gone into CT certifications or have, gone into the ultrasound program that do keep their full-time jobs or transition into a part-time job if they feel that it would alleviate their stress, since, it is a vigorous program. I can't say it's extremely difficult, but if you study and you do your, your studying and your work, according as you should, I think it's very feasible. I know I had a part-time job, and I had 2 kids when I went through the radiology program. So I know if I can do it, you guys can do it too.
Perfect. And Ms. Bird, I don't know if you want to piggyback off of that, if it's been your experience that some of your students also are employed and able to take some of the courses, or what your experience has been with that?
It depends on the program that the student is actually enrolled in. In regards to our radiology program, we do have students who do work. If they do, then it's more of a part-time basis. They'll end up working, I'm going to say probably between 15 and 25 hours a week. And we have other students that have the luxury where they don't, they're able not to work. I'm a graduate from this program as well. I was the second class, so I graduated actually in the year 2000. So I've been a tech and I've been here for quite a long time. And I know I worked as well throughout the entire program. The sonography program, because the individuals coming into that program, because they already have at least a minimum of an associate degree or higher, then basically everyone works. Very few people don't. And the CT certification program, everybody works with that one. So we try to kind of accommodate and tailor our hours depending on the program to try to allow as many people who are interested in pursuing their degrees that they're able to come on board with us and that they're able to attend.
Perfect. It looks like we have one more question coming in from La Jolla. They were wondering how x-rays are taken with patients who have Parkinson's.
That's a good question. The movement, obviously, but we have to watch our patients and we have to monitor the patient while we're exposing the x-ray. So sometimes you're able to get a decent x-ray by watching the patient and waiting for the movement to happen and trying to catch it in those few seconds that they're not moving. And other times you end up with a slightly blurry image, and basically we can't keep exposing the patient over and over, so you just have to make a note and make the radiologist aware of the situation.
That comes a lot with experience. You know, Angela is a very experienced tech, and she is our coordinator. So she's learned how to adapt, and work with the patient's condition.
Okay, ladies, well, it's 10 o'clock, and I just wanted to say that I've had several comments coming in about what a great session this was and how informational it was. And so we want to thank both STC and DHR for having such an exemplary presentation, and we love the behind the backgrounds of all of the equipment, as well as having a student available to talk to the students. So thank you so much on behalf of all the school districts, on behalf of Project HEAL, and we did record this session, so we are going to be providing a link. So all of the other students that were unavailable now are going to log on to the link and be able to access this session on YouTube. I will be sending that information. But as always, thank you so much for helping us. And it was such a great session. Everybody give themselves a round of applause. Thank you. And you guys have a great Friday.
Bye. You too. Thank you.